I think effective leaders are value-driven. So the most effective leaders, so the number one job of an effective leader is to navigate change and to help others to navigate change, right? So if we didn't have challenges, problems in this country and in our families and our communities, we wouldn't need leaders, right? The number one work product of a leader is to help to navigate change, to fight for something that is at risk, to end something that is unjust, to innovate where it's necessary, whether it's in the non-for-profit community, in the private sector, or in government. The core business of leadership is navigating change, right? So if we need leaders to navigate change, the most important work in that is to be value-driven, is to understand what the values are that either cause a leader to say, we must strike this down, or we must lift that up. And no leader effectively can do that individually. So what else does an effective leader have to do? They have to be able to then take the value, develop it into a vision, and be able to communicate that vision to build a team, whether it's a family, a community, a country, or a group of countries, to push for that change. So effective leaders are value-driven. They develop vision that they can communicate. They're able to effectively communicate that vision. They're able to listen to the feedback of others and tweaking that vision. And then in doing that, they're able to build teams to create pressure to execute that change against that vision. Rather than name individuals, I think the most effective leaders in healthcare are those folks that are value-driven and focus first on getting it right. In my experience, healthcare leaders that focus on getting it right, on doing the right thing, the bottom line works out for them. You know, whether they're a large non-for-profit enterprise that has to produce reserves for the non-for-profit, or they're a for-profit enterprise, effective leaders who focus on doing what's right deliver a solid bottom line. I'll tell you a story about one person who I admire tremendously in the hospital space, and that's Neil Meltzer and his team at LifeBridge Healthcare. There was a person that was a frequent flyer at the LifeBridge Emergency Department. They were a repeat visitor with their healthcare needs to that emergency department. And that particular patient was struggling, much like my mom, with managing her diabetes. You know, my mother passed away at a relatively young age because she just simply wasn't able to manage her diabetes. It's challenging for folks. Similarly, recently there was a patient at LifeBridge that had life challenges that made it difficult for that patient to manage their diabetes. And so they showed up in the emergency department. And over time, the people working in the emergency department started asking different questions. And what they found out was this patient loved to cook. But the patient's oven and stove had been broken for some time. And so the patient couldn't cook anymore. And they loved it. And more importantly, they were cooking good stuff, you know, food that was good for a diabetic to consume. And so the patient was eating maybe not so healthily because of the broken oven and the broken stove. And so when the leadership team at LifeBridge found out about this, they just said, well, let's buy her a stove. Maybe the healthcare problem isn't her medication management. Maybe her healthcare problem is if she had a stove and she could cook, she'd eat more healthily. So they just bought the stove. And I think that's just a profound demonstration of effective leadership and how effective leaders ask the right question, you know, and work in team. I'm pretty sure Neil Meltzer wasn't the person interviewing the patient in the emergency department. I'm pretty sure that there's a couple of steps between Neil and the hospital CEO and the social workers and the nurses and the physicians. But in the end, the solution they put in place, which was as simple as spending a few $100 for somebody to be able to eat more healthily, probably saved tens of thousands of dollars in terms of the healthcare system. and probably increase the engagement of that patient in terms of their daily life. You know, so I really couldn't do Triple Latte Leadership without Beta-More. You know, so Triple Latte Leadership, it's organized, it's great, it's part of the name. I can go have coffee at Starbucks or Stone Mill, but it's not about the space, right? It's about the community. And when I show up at Beta-More, whether it's for a thinking session, a brainstorming session with some of my colleagues, or whether it's actually to do some private executive coaching, it's about being in the place and the sense of community and folks helping you out. You know, so if I have a need on something specific, like right now, I'm trying to figure out how to do something specific on social media, right? So my email comes to Beta-More, and it comes to my community at Beta-More and say, hey folks, I'm trying to do this. Has anybody done it? Is there an easy solution? So my consultancy, it's a small incubation consultancy for a guy who's blessed to have a really great day job that I'm passionate about, but I also feel a calling to do Triple Latte Leadership, and I couldn't do Triple Latte Leadership without the support, without that sense of community from Beta-More.